Now we will meet Lynette Pinkston, Administrator for Novant Health Endoscopy. Lynette, thank you so much for joining us today. We're glad to have you back on the show. For our viewers who maybe haven't met you before, can you tell us a little bit about yourself and your background?
Okay. My name is Lynette Pinkston, and I've been a nurse for a little over 15 years. The last half of those years I've spent at Novant Health here at Brunswick.
Nice. Very good. Well, we're excited to have you in our community, and I understand that you have a new role. When you were with us before, you were Med-Surg manager, nurse manager for Med-Surg, and now tell us a little bit about your newest role.
Well, prior to taking the Med-Surg manager role, I did almost 2 years in the surgical area as the assistant manager. So when the opportunity came up to accept the administrator of the new endo role, I felt like that would be a good blend of what I've done in the past, and just exciting because it's new, and you know, we're moving forward, we're making decisions about the building. It's very exciting to go from the ground up.
Yeah, very good time to come into something. It's always fun to be a part of something new, and I think everybody in the community is excited about the new endoscopy center as well. So tell us a little bit. We'll start with the easy-ish question, I guess. When is it going to open? You know, everybody's ready to hear about that.
We're tentatively scheduled to open March the 12th of this year.
Nice.
We're located at 13 Medical Campus Drive in Supply, North Carolina, and that's just a little over 2 miles down from the hospital.
Okay, kind of near the old hospital, right? In the medical campus that's sort of across the road, I guess.
Correct.
The brick buildings, I always refer to them as.
Correct.
Great. Well, that's a good location, central to the county. Tell me about the services, because a lot of people, when you hear endoscopy center, what does that really mean? What services are going to be offered there? It might be a little
confusing for people. Patients are going to be screened prior to coming to the endoscopy center, so we can determine the best location for their procedures, because patient safety is always at the forefront.
Okay, so whether a procedure should be done at the hospital,
versus
or at the endoscopy center, because everything at the endoscopy center will be outpatient.
Yes, it'll all be outpatient.
Which means they'll go home that day.
Exactly.
Okay, so what you're saying is in some cases it might still be necessary to do an endoscopy or colonoscopy in the hospital.
Correct.
Due to patient safety and making sure they're in the right place. Okay, that's good to know, because certainly safety is most important, for sure. Okay. So what about physicians? Now, so you said there would be colonoscopies and endoscopies. So surgeons, who would be coming into the center to provide these services?
We're going to continue to partner with Dr. Holt of Coastal Gastroenterology. And we've got 2 new gastro docs coming on to join Dr. Lamphere and the Novant GI.
Perfect.
And that would be Dr. Rice and Dr. Itzkowitz.
Perfect.
People that choose to see the general surgeons at Novant, Dr. DeSandre, Beninati, and Dr. Smith, they'll also be able to practice out of the Endo Center.
Okay, and that's Novant Health Surgical Associates, correct? Yeah, and they offer colonoscopies as well, right? Okay, preventive, diagnostic, whatever's needed. Very good. Well, it sounds like there's already some good partnerships set up out in the community. What would you, if you had to say, what would you most want people to know about this new center and why they may want to have their procedure at the new center?
Well, insurance companies are going to drive a lot of that.
Okay.
You know, it's about the dollar sometimes. It's going to be a better choice for the patients to go there that do qualify to go there, and they're going to receive the same remarkable care at the center that they would at the hospital.
So kind of, because it's an outpatient procedure, in the end, the cost is a little less, right?
Correct.
Well, it's a great benefit, because I know people have had to drive out of the community in the past for an outpatient colonoscopy, so this will be a great new service. Now, what about, if someone is interested in scheduling, how does this work? Because typically these would require a physician referral.
Yes, they would. A lot of this is going to be based on the patient's insurance carrier.
Okay.
What they need to do is really just start the conversation with their primary care physician.
Okay, all right. So if they haven't had a colonoscopy before and know they're preventatively needing one, talk to their primary care. It will kind of help them navigate, maybe get to one of the practices that you talked about.
And I guess the only The last take-home message that I would like to give our community is how important this is for screening and early detection, so we can start early treatment for anything that they may find.
That seems to be a theme of our show today, is really all about prevention and helping people get better, feel well, keep things from getting worse. So while we don't I don't think anybody looks forward to a colonoscopy or an endoscopy for that matter. It's something better to get done. Age-wise, is it typically 50? Is that when the colonoscopies start to?
Typically, unless there's, you know, some issues or, like I said, family history.
Gotcha. Well, thank you so much.
You're welcome.
It's clear you have a real passion about taking care of patients in this community. Thank you for joining us today. We appreciate it.